first of all, I have to say thanks for the invitation. So my name is Lulu, and I'm an oral health educator. And I've been working at North Richmond Community Health Center for 5 years. It's a great pleasure to share our dental and diabetes project here. So what I would like to share today is why we run this project, and what is the periodontal disease, and how the project works in our community center, and some case studies as well. So, the relationship between periodontal disease and diabetes goes both ways. So periodontal disease can make it more difficult to keep blood sugar under control, and also people with diabetes have a higher than normal risk of periodontal disease. So periodontal disease is a very common chronic inflammatory disease. It's highly prevalent and has multiple impact on quality of life. A recent Center for Disease Control report provides the following data related to prevalence of periodontitis in the US. 47.2% of adults aged 30 and older have some of the form of periodontal disease, and periodontal disease increases with age, and 70.1% of adults 65 years and older have periodontal disease. And this is common in more like men than women. And also, diabetes is the fastest growing chronic condition in Australia. So it's increasing at a faster rate than another chronic disease. Nearly 1 in 4 adults over the age 25 has either diabetes or condition known as pre-diabetes. Evidence shows that people with pre-diabetes can delay or reduce their risk of developing type 2 diabetes by adopting lifestyle changes. Oh, hang on. Sorry, before I go to the next slide, I really would like to check if everyone's fine with a picture of gum disease. So if the pictures make you feel uncomfortable, please feel free to look away. Maybe at the moment you think, what is periodontal disease? So, periodontal disease are infection of gum and bone that hold the teeth in place. So the photo showing here, which is with a gum recession and the root exposure of gingivitis. And the healthy gum, so the X-ray showing red line with a bone level, and the calculus, which is at here and here is at the blue arrows. So in a patient with periodontal disease, and compare healthy patient. So periodontal disease has 2 stages. So early stage is gingivitis, as middle of the picture here. So it's due to poor brushing and flossing daily routine. A lot of dental plaque, which is a sticky film of germs to build up on teeth, and which is the plaque you can refer to here in this picture. So on the left. So it causes red and swollen gum, and also may bleed when brushing or flossing. At the advanced stage, we call periodontitis. So which is the right side of the picture here. It's an infection of tissue that hold the teeth in place. It's due to plaque builds and harden under the gum. So the gum pulls away from teeth and forming pockets of infection. So they lead to painful chewing and eventually tooth loss. Normally, when patients come to us for an initial examination with our dental hygienist and dental therapist, so if identified at high risk, Oh yeah. So if identified at high risk with periodontal disease, they are then referred to me. So during the first oral health education sessions, I used the AUSRISK assessment tool to do the assessment on the patients. If they are at high risk with diabetes, then I do refer them to see our diabetes educators. And when I receive the verbal consent, if they have external GP, then I will provide them a copy of their assessment sheet and a refer letter, and also I just recommend to bring their latest blood result when they return to see diabetes. So another way, diabetes educators always check with their clients as well the time of the last dental visit. If the clients have not been see a dentist for more than a year, then they are referred to us. So this slide shows a 49-year-old Asian patient, no medical history, female patient, and came for the examination, diagnosed moderate to advanced periodontitis. As the photo showing particular highlight in red arrows, so which is here, and the posterior is hardly to see. So that's the radiography we took. As you can see, her bone level has been reduced. And here's a Perio chart. So red lines there means pocket depth, and the blue line, which is here, that's the gum recession. And any numbers there in red above 3 means increase in pocket depth and also indicating periodontal disease at present. The little highlights of little triangles there means vacation involvement. And on the left side, yellow boxes has been filled. That's the plaque accumulate area. And also that the boxes has been filled in red. That means bleeding unprompted. And also means active gum disease. So this is also risk assessment tool I use. I went through 9 questions and taken her waist measurement and added up all her points, and it was 21, which is at a high risk of developing diabetes. So, and then I referred her to see diabetes educator, and after I received verbal consent from her. So, due to the time, actually, as Roger, I prepared some photocopies for you, and you can take them, if you're interested. So, during oral health education session, so we always use the plaque disclosing solution to exposure of the plaque onto the surface. Any pink and blue color, which is require more cleaning the areas. So it is much more easier for patient to understand our recommendation. And so those 3 photos, actually I've been talking during her oral health education sessions. In red arrows showing the improvement between the first, second, and third visits. And also in yellow zigzag arrow showing the difference between second and third visits, so which is more interdental cleaning. And that's the right side of the posterior and the left side of the posterior. And we always discuss with patients the link between oral health and general health. After her visits, she has been referred to a dentist within the practice to commence her treatment. And the patient was very impressed and appreciative of our service. This slide showing 65 years old Asian male patient and referred by diabetes educators. He's newly diagnosed with type 2 diabetes, and he came to had an examination with our operator, diagnosed generalized generalized advanced periodontitis, as is showing in picture, which is all like red arrows. And also you can see bubbly saliva is at present as well. So the X-ray has been taken. As you can see, his bone level has been reduced as well. And that's his period chart. That's the like anterior of his mouth, and the right side of the posterior, left side of the posterior. Well, so actually we received a lot of good feedback from both ends, which is from our clients and from our own staff as well. So from patients, actually they feel kind of receive more assistance in our community center, and also feel it's comfortable to build up trust with our with our staff, and the awareness of service in referring to specialized clinician. But from our end, which is our staff, and we feel it's much more easier to help patients to participate in our program, and also is enable us to break down the barrier between patient and the staff. So we run this project to assist in the understanding of relationship between oral health and diabetes. We highlight the techniques and the ways to maintain good oral hygiene, oral health, and assist in the control of diabetes if present. And we ensure patients are aware of our service available in the our health field and know how to access the service. So let's work closely together to ensure patients understand the maintenance of good oral health is as important as their general health. Thank you. Thank you.